Hello and welcome to our 24th episode on Minor Talk. I'm Yashni Bhaskar and I will be your MC for today. We are here to launch an episode to dive deeper into chronic kidney diseases. Here, we are extremely lucky to have Professor Dr. Lim Sokhorn as a passionate nephrologist with us on board to enlighten us about chronic kidney diseases. Doctor?
Hi, Mirashini. Yeah, good afternoon. Thanks for your invitation. So probably just a brief introduction on myself. I'm Professor Dr. Lim Sokhorn. I'm the Senior Consultant Nephrologist and Head of the Renal Division at University Malaya Medical Centre. Nice to be here.
Thank you for joining us today, Doctor. So, since there are rising cases of chronic kidney diseases in our country, how aware do you think Malaysians are regarding chronic kidney disease based on your experience, and how common do you think chronic kidney disease is in our country?
Based on my personal encounter with patients, I have the impression that many people are not aware of this chronic disease. Mainly it's because it's actually asymptomatic. That means even though somebody have chronic kidney disease, they may not fear it, right? They only will know if they go for the test. So this is probably the reason why many people are not aware. And if you look at one of the study published in 2020, quoted that there is actually about 15.48% of adult population in Malaysia actually having chronic kidney disease. And they actually interview about 158 respondents who will actually pick up to have chronic kidney disease during the survey. Only 5% were actually aware of the disease. So you can see the percentage is very low. And of course, I think this is actually not just limited to chronic kidney disease. Even for diabetes, in the National Health and Morbidity Survey in 2019, we have about 18.3% of adult population in Malaysia having diabetes. About half of them were actually undiagnosed and unaware, even though they were actually picked up during the survey. Right, so you can see a very common phenomenon. I think one reason is because this kind of disease they have no symptom. The second thing is also reflecting our public awareness. Right, so that is, I think, the reason why you want to do this interview.
Yes, of course, Doctor. This is to spread awareness among the public as well. And I think it's our job to raise more awareness among the public in Malaysia. So, going next, what will be the changes in lifestyle and difficulties faced by the patients with chronic kidney diseases?
So when we manage chronic kidney disease, there are 4 principles. The first thing is we want to delay the progression of chronic kidney disease. Second, we want to manage the complication arise from chronic kidney disease. And the third is to manage the cardiovascular risk factor, because we know many people with kidney disease, eventually they have heart problem. The fourth is, of course, to prepare them for renal replacement therapy if the disease progress to end stage. So we can see that for CKD diet, right? The diet is actually play a very important role in terms of delaying the progression of the disease, as well as to manage the complication. So for example, low salt diet and low protein diet will be important in terms of delaying the progression of the disease. And as the disease advances, you can see more dietary restriction will be applied to these patients. So when they progress to stage 4 or stage 5 kidney disease, then they need more restriction in terms of diet. For example, low potassium, low phosphate, low purine, in addition to fruit restriction. So you can imagine there are a lot of lifestyle changes need to be made, because when you ask somebody to actually restrict their diet, it means that they need to change their lifestyle, right? So that also highlights the importance of early intervention. So you can imagine if somebody at stage 4 heard for a very first time they need to take low protein diet, if all the while nobody actually tell them and they have been taking very high protein diet So you can't expect them to change overnight, right? So change in their lifestyle, we need to start very early in the disease. So that's why it's a very important part in the management of CKD to talk about early diagnosis, early intervention, so that we can actually incorporate all these changes into the patient lifestyle from the beginning of the disease.
I see, doctor. It seems that it's such a tough journey for all the kidney patients to change their lifestyle. So, since you were talking about early detection, that is one of the reasons that Malaysians fail to be aware of the kidney disease because it's asymptomatic. What do you think should be the early detection for chronic kidney disease?
So, as I mentioned just now, chronic kidney disease has no symptoms, especially in the early stage. So we cannot depend on symptoms to actually diagnose an early kidney disease, right? So the most sensitive test so far is a urine test. So when you do urine test, what we want to look for? We want to look for protein. Because in a normal individual, we do not expect excessive protein leaking in the kidneys. Because our kidneys is like a filter, right? So if your kidneys are normal, then we do not expect the protein to leak in the urine. So if somebody is actually having a protein detected in the urine in the large amount, then that is the first signal that somebody's kidney might be having problem. Of course, we can also do blood tests. So commonly when people go for medical checkup, they will do blood tests to test for their kidney function. So as you learn in the medical school, you know that when we test for serum creatinine, it can actually auto-calculate their glomerular filtration rate to tell us how good is the kidney function. But serum creatinine is not a very sensitive marker. So when somebody have a serum creatinine which is above normal, a lot of time he or she probably already lost about 50% of the kidney function. So it's rather late to wait for the creatinine to come up above normal. So when we talk about screening, there are two things we need to do. First thing is to identify the high risk group. That means we have to know an individual whether they are at risk of having kidney disease or not. Of course, the high risk group will include those people with diabetes, with hypertension, with older age, more than 65, those with obesity, those with heart problem, or those which have been taking medication that may cause kidney damage. For example, the non-steroidal anti-inflammatory drugs, right? So if you already identify that somebody is actually high risk, then of course we want to do screening at the regular intervals to detect the disease early. And the best screening test to date is actually a urine test to test for the albumin or protein in the urine.
All right, doctor. Since we have like such improved number of screenings available, let's just say if after screening someone is known to have like chronic kidney disease, what are the treatment options for those people, and are they affordable in our country?
Yeah, definitely. Many people have the impression that chronic kidney disease is not curable, is not treatable. That's why they are not keen to see the doctor, to see the kidney specialist. Actually, this is a wrong concept. As I mentioned just now, there are 4 principles when we manage patients with chronic kidney disease. And one of the most important is to delay the progression of kidney disease. So I probably will explain a little bit further what is the concept of delaying progression. So as we know, normal people, if you have no medical condition, your kidney disease most of the time are very stable. Probably after the age of 40, of course, you are still very young, but after the age of 40, our kidneys will actually deteriorate in terms of function because of the aging process. But the deterioration usually is very slow, probably only about 0.5 to 1 mils per minute per year, right? But if somebody having kidney disease, having diabetes or hypertension, which are not controlled well, the deterioration of kidney function can be very fast. It can be up to 12 to 20% a year. So you can imagine, normal, we are talking about 0.5 to 1. per year. But those people with kidney disease, with uncontrolled diabetes and high blood pressure, they drop their kidney function 12 to 20% per year. And that is very fast. So you can imagine how many years it will take to reach the kidney function of 10, right? So our task here is to actually delay the progression. So when we say delay the progression, that means we slow it down. Right? Maybe from 12% a year, we can slow it down to 2% or 3% a year, even though we are not stopping it. But when you slow it down, then people gain more years before they reach end-stage kidney disease requiring dialysis. So that is the purpose of the current management. Of course, I want to touch on what are the probably a general principle. How do we do that? Right? So if you think about that, somebody who have diabetes, hypertension, having kidney disease, when we want to delay the progression, what we're going to talk about is something very fundamental, right? And logical. That means you get the sugar under control. You get the blood pressure under control. You make sure that you are taking the correct medicine, which will actually give protection to your kidney, which will help to reduce your protein leaking. You want to avoid taking medication that may damage your kidney, right? And of course, last but not least, is to have a very appropriate diet. Because as I mentioned just now, diet play a very fundamental role in addition to all this medication and management of chronic kidney disease. You can't depend on just medicine. You have to actually change the lifestyle, change the diet habit appropriately, then you can achieve the purpose of slowing down the progression of the kidney disease.
Oh, that's really great, doctor. I think after this talk, like patients who are with chronic kidney disease will have a hope that it is treatable, and also we can eradicate the impression that chronic kidney diseases are not curable, because it is curable. And since like you have like worked under the nephrology department, and also like about for chronic kidney in improving chronic kidney diseases, what type of improvements could be made in terms of the treatment options in the future?
Of course, now what I'm talking about is the current available treatment, so to delay progression. But if you look at the science, advancements of science, and also a lot of trials going on, so people are trying to improve our management, moving towards regeneration of the damaged tissue. Right? For the meantime, we cannot do that. Right? For the meantime, we are able to just reduce the pressure inside the kidney, reduce the protein leaking, so that we slow down the progression. But the future direction will be to regenerate the damaged tissue inside the kidney. Of course, there are various ways of us doing that. One of the approach is to use drugs that can reduce the inflammation and the fibrosis in the kidney. Then you can actually allow the kidney to regenerate. Second, we have actually seen the advancement in terms of stem cell technology. Right? Stem cell can be used to help to the body to regenerate damaged tissue. So this is one of the potential area. Of course, if all this thing has been done and the kidney still progress to failure, you can see that a lot of now study looking into bio-artificial kidney. That means you are inserting something, a device into the body, making it like a kidney to actually filtrate all the waste product, excess of water from the body. Of course, transplantation, I believe, will still be one of the important treatment for patients with kidney failure. Yeah. But of course, for the meantime, what we do is to get the donors from a human. But if you read the current literature, you can find people are talking about xenotransplantation. Xenotransplantation means you are getting an organ, in this case is a kidney, from a different species, not human, but transplant it to a human who have kidney failure. So if the kidney start to function, it can actually replace the function of the damaged kidney. Of course, this is actually not easy because we have to take into consideration a lot of potential side effects. For example, we do not know that animals where we take the organ from whether they carry certain virus or bacteria that may be transmitted to the human. So we have to make sure it is safe first before we do that. But there has been a lot of research in this area looking into expanding the source of the organ. Because one of the challenges we face in transplantation is the demand is always higher than supply. So we do not have enough kidneys to perform transplantation for patients. That's why people are moving toward that direction.
That's very interesting, doctor. The xenotransplantation and also using artificial kidneys will definitely bring an improvement in the medical sector. And with the advancement of the science and technology, I hope that we can make it a success. And doctor, one of the treatment options for chronic kidney disease is also like hemodialysis, right? So can you share your thoughts and your experiences in handling hemodialysis?
So if you read the history in hemodialysis, this is actually a very great innovation since 1960s. The first concept was actually put up in 1920s, but the human dialysis was only performed in 1960s until now, so not too long ago. But the idea of a hemodialysis is to replace the function of the kidneys. That means what we are talking about is not to reverse the kidney failure, but we are just basically using a method to actually replace the function of the kidney, to remove the waste product, to balance the electrolytes, to remove the excess of water from the body in somebody who suffers from kidney failure. So for the meantime, the standard regime for hemodialysis will be a 4-hour session, 3 times a week. Why is 3 times a week? Because this is how people work out. This is probably the most cost-effective way of doing hemodialysis. But you can imagine our kidneys work 24 hours a day, 7 days a week, never stop, right? But when somebody's kidneys is not functioning and you are using a hemodialysis to replace the function of the kidney and you are only doing alternate day, definitely we can expect this will not be able to fully replace the function of the kidney. It has its limitation, right? So that's why we are seeing a lot of people with long-term hemodialysis, they suffer from complication. Complication is because this treatment is imperfect, not able to fully replace the function of the kidney. But having said that, we have to acknowledge the contribution of hemodialysis because it's life-saving, right? Because you look at all the organ failure, right? Heart failure, liver failure, kidney failure. Only kidney failure we have dialysis, which can sustain a patient's life and give them some quality of life. But those people with heart failure, you don't have any heart dialysis. Liver failure, you don't have actually liver dialysis in order to sustain life. So that's why I think even though hemodialysis is not perfect, but we have to acknowledge its contribution in terms of this advancement to give patients some quality of life and also life-saving.
Yes, doctor, you're right that hemodialysis is indeed a great invention in the nephrology department. So, regardless of all these treatment options and also the efforts being put in order to improve the treatment for patients, we all know that prevention is definitely better than cure. So, in that case, what kind of lifestyle and habits could combat kidney disease and how one can improve his or her renal health?
So when we talk about prevention, of course, we have to understand what is the cause of kidney disease, right? So you have to know the cause, then only you can try to prevent it. So if you look at most of the statistics, particularly from Malaysia, more than 80% of the kidney disease are actually due to diabetes and hypertension. So these two are the most common causes of kidney disease in Malaysia. Right? So if we know this important fact, then we will know one of the important things we have to do in terms of primary prevention is to actually reduce diabetes and reduce the occurrence of hypertension. Of course, this is easy said than done, but at the same time, it also gives us opportunity because we know that diabetes and hypertension is not an inherited disease. but it's a lifestyle-related disease, right? So if it's lifestyle-related disease, definitely we have the opportunity to actually reduce the risk. We might not be able to eliminate the risk 100%, but definitely with certain intervention, a healthy lifestyle, and exercise, we can reduce the risk of having diabetes and hypertension. So if we can reduce this, definitely we can reduce the occurrence of CKD, right? Of course, we know that certain people who have high family history, they have family history of kidney disease, even with all this prevention, they might still progress, right? They might still develop CKD. So in that case, we have to talk about secondary prevention. That means something has happened. You already suffer from chronic kidney disease. Then our strategy will be to treat it early, to protect the kidney and try to preserve the function. So that is what I talked about just now, about delaying progression of kidney disease. So you can see that what we can actually do a lot of things. The only thing is it cannot be just at the doctor individual level. We need the buy-in from everyone, talking about public, talking about patients, talking about doctors, as well as our policymaker, right? So we need to change our policy so that it can actually help us to handle this non-communicable disease better.
Yes, doctor. So I think that unity and also cooperation from everyone is needed in order to reduce the number of cases of chronic kidney diseases. So since we are nearing the end of the interview, what will be your advice and last words to people regarding kidney disease before we end this interview, doctor?
So I have a few take-home messages. The first thing is, even though we talk a lot about chronic kidney disease today, but I just want to highlight that not all kidney disease are chronic kidney disease. Yeah, certain disease is actually curable and treatable. Yeah? So when somebody was detected to have an impaired kidney function or protein or blood in the urine, we shouldn't jump into the conclusion and say that must be chronic kidney disease. Yeah, sometimes it can be an acute condition. Right? So if this is an acute condition, then we have to find the cause in order to treat it, hoping that it can reverse. So that is something very important. Because I notice a lot of time when we talk a lot about chronic kidney disease, people have the idea saying that all kidney diseases are chronic kidney disease. That means once you start to have it, it's not curable, it's already the end of the world. So that is not right. Yeah. So the second point I want to bring up is, even though someone has been diagnosed to have chronic kidney disease, it doesn't mean the end of the world. We still have a lot of measures to actually intervene. As long as we intervene very early, then we are able to stabilize the disease and prevent kidney failure. And especially in the recent years, we have seen many new innovations in terms of medication that can actually give protection to the organ, particularly the kidneys as well as the heart, in order to reduce kidney failure, to reduce heart failure, right? So never lose hope, right? The science is actually advancing. We are many more medication that can actually help people with kidney disease. Yeah.
So I will say that we are literally living in the perfect era where like a lot of efforts are being put in improving treatment options, and also the science and technology is really helping us in order to help the patients. So with this, we will definitely have like less number of people with chronic kidney diseases and more healthy people. So thank you so much, doctor, for giving us all these tips, insights, and also important things in information regarding chronic kidney diseases. And we really hope that all this information and insights are really helpful to people to raise their own awareness, to be more aware of chronic kidney diseases, and also, like we discussed, take care of their health, exercise regularly, maintain a good diet in order to prevent themselves from having kidney diseases. Thank you so much for joining us today, doctor, and thank you for listening to our episode today.
Thank you. Kidney health for all. That is our logo slogan. Thank you.
Thank you, doctor.